all of our affiliated unions how much work we put into the organizing to get comprehensive health care reform passed. It's been a major, major organizing project for us. But let me ask this. How many of you actually made a phone call, sent a letter, or participated in some sort of event around the healthcare campaign? Would you raise your hands? Oh, that's terrific. That's great. Some people have raised 2 hands. That's really good to see, because so often, you know, we think we've got this huge movement going and we're not getting to so many of our members. And I'm not going to spend time on this at this point, but I think that as a result of our reorganization efforts through the new alliance and having our area organizers working with labor councils and local unions around the state, we've got capacity around the state to be getting 2 folks on the ground and getting a better chance of getting people involved in campaigns like this. We're just beginning because we have got so much work to do in developing our capacity for communication with rank and file members as well as mobilizing them for action. And I'll be saying a little bit about this in my concluding. During the signing of the bill, and what he goes on to say is that, you know, there are a lot of union people in the room here who were so important to passing health care reform. So we get our recognition from the President, who realized that, you know, we were a key part of the coalition that made this happen. These are the various kinds of things that were happening, especially at the end. Lobby phone calls, obviously, meetings with members of Congress. In the last couple of weeks, as we were leading up to the vote and in the House, trying to get those final votes for this very complicated process of final passage through reconciliation. There were even some sit-ins in Pennsylvania in some of the offices of members of Congress who were either wavering or hostile. But a lot of different events that were happening all over the country. Rich Trumka, president of the AFL-CIO, elected at the convention last September. Rich was really right in the middle of this battle. And talked from the right about the fact that this is a government takeover of our entire medical system, 1/6 of our economy. This is not radical change. And in fact, I think a lot of us would wish that it were a lot more radical change. But basically, you know, it maintains the whole current structure of our healthcare system. It maintains the employment-based system for those who have decent health insurance through their employers. And that was the whole idea behind that slogan, that if you have good health care and you want to keep it, you can keep it. And that is sort of the fundamental principle of this model of healthcare reform, that we will maintain that system, even though we have to defend it every time we go to the bargaining table. But what it really does change is simply some regulations on the insurance industry, plus getting decent, good quality health care insurance to about 32 million people that don't have it today. It is a big change, because when this thing is fully implemented, 95% of Americans will have health insurance. I could never figure out who the 5% were. We want to go through very quickly in terms of the elements of the health care reform bill itself. In terms of consumer protection, with regard to pre-existing conditions, for this year, this is all 2010, so these are things that are going into effect immediately, that it outlaws denials or higher rates for kids, and then in 2014, the denial for pre-existing conditions kicks in for everyone. It also has a guaranteed issue provision, and it also bans rescissions, which means health insurance companies simply canceling policies when people develop serious illnesses because they don't want to pay the big bucks that we're supposed to be insured for. So immediately that goes into effect. Benefits. Now, this is something a lot of people don't realize, but most health insurance policies both have annual limits of what they will pay for medical care, plus lifetime limits. And I suspect that everybody in this room, or at least 90–95% of us, have limits on our health insurance policies. And that's why you find a lot of times that people who have decent insurance nevertheless get into bankruptcy because they have such serious illnesses that go beyond those limits. Well, immediately, the lifetime benefit limit is eliminated. And then by 2014, the annual limit is eliminated. So it means that no matter what your medical needs are, they are covered. The insurance companies cannot put a limit on what they pay for medical care. It ends tax credits if they are low-wage small businesses, so that this enables more small businesses to offer health insurance to their workers. For those on Medicare, it shrinks that donut hole. How many of you know what the donut hole is in Medicare? A lot of people don't know. You're going to you would have found out when you retired. When Medicare Part D, the prescription drug part of Medicare, was passed when Bush was president, I don't know how they came up with this, but even though you pay a premium for that, and you pay it, no matter what is happening, it covers, I think, the first $2,600 worth of medications, and then it stops paying at all. You have to keep paying the premium, but it gives you no coverage until you get somewhere above $5,000 worth of prescription costs, and then it kicks in again, sort of as a catastrophic policy. Gradually, over time, this new legislation eliminates that gap in coverage. And for this year, those who get up to that $2,500 limit, whatever it is, they will be getting an additional $250 worth of payment. But by 2014, that donut hole, as it's called, it's going to be eliminated entirely. Major help for those who are on Medicare and those who have, especially high prescription drug costs. There are going to be early retiree subsidies, so that those who retire before they are eligible for Medicare will be getting some subsidies in order to be able to afford health care in that period between 55 and 64. We talked about the pre-existing conditions issue. If this bill will not ban insurance companies from not covering pre-existing conditions until 2014. That's when it totally kicks in. In the meantime, there are going to be some essentially high-risk pools that will be subsidized by the federal government for people who have pre-existing conditions and can't get insurance in the private market. It's kind of like our HRSA program in Wisconsin, except that the HRSA program, which is intended to do exactly the same thing, is very expensive, and it's not subsidized, or it's not subsidized enough. So this will be a real improvement. For both checkups and screenings, there will be no charge for preventive care. One of these, again, elements that will help to improve the quality of our care, but also have an effect on cost. Because we know that if people get the preventive care, this is where the primary care physician comes in as well, but if people get primary care and they have preventive care and screenings, you catch stuff earlier, you can treat it, it's much less expensive, and people stay healthier. So this can be a real improvement.